Right now, we want to get started with the first discussion, and this is on our Health Tuesday segment. And as earlier mentioned, today we're going to be putting focus on home-based care. It is something that is slowly but surely being adopted by many people. But for you who may be watching us today and, don't really know much of what goes into the home-based care, this conversation is for you. And joining us to help us with this particular conversation via Zoom, we have Dr. Theophilus Wangata, who is a general physician working with Precise Healthcare. Good morning, Dr. Thank you for being with us. All right, we'll be getting back with Dr. in a bit. Let's just get to sort out the audio issues right there. But just looking at home-based care, this is something that has always been a norm. When you look at the Western side of things, home-based care is something that has been adopted and is being used by so many people. But looking at our space here, it is something that is still considered new, and slowly but surely people are gravitating toward it because it has a number of advantages over disadvantages compared to the traditional way of accessing medical care. And that is why we are here to give you all the necessary information that you need to know before you get to choose this form of medical care. And again, if you have any questions or comments, or you're just seeking clarifications in regards to this particular topic, send them through using the hashtag #GoodMorningKenya on Twitter. So I do believe we are good on that audio right now. This is live TV, so anything can happen. We do appreciate the challenges that do come with live TV. But getting back to our guest, Dr. Theophilus Wangata, once again, a general physician working with Precise Healthcare. You could say hi again to our viewers.
Yes, hi everybody. I hope you can hear me now.
There we go, loud and clear. Thank you for making time to be with us this morning.
Yes, thank you, Jain, and I truly appreciate to be on this show.
Absolutely. Maybe we could start by you giving us the social media handle so that our viewers can also interact with you and the facility on the socials.
Yes, so you can reach us on our social media at, we are on Twitter, Facebook, and Instagram, and LinkedIn as well. So you can reach us on all our social media platforms at Dr. Theo KE. For my personal social accounts, and at Precise Healthcare for all the other social media accounts.
All right, fantastic.
And also
so let's
you
just
can
dive
call us
straight.
On our phone numbers 0713-749-001.
All right, there you go. So you can also interact with them using that particular number. Okay. So let's just get straight into this conversation, and we can start by getting a proper definition of home-based care. When we talk about this from a medical standing, what does it entail? What does it cover?
So basically, Jain, that's a good question. Home-based care means treating a patient from the comfort of their home. Because traditionally, patients are treated in the hospital, and this is a new way or a different way of doing things. And especially during this COVID pandemic, it has become very helpful and very necessary to help those who need to seek medical attention at their own comfort. And especially if they have to isolate themselves, those who have COVID, for instance, then home-based isolation or home-based care becomes a good option for their treatment.
Yes. Now, when we talk about home-based care, maybe one would be thinking it's limited to specific, types of conditions or illnesses. But from what you offer, what kind of services and conditions do you offer this home-based care that you feel this type of home-based care is good when it comes to addressing certain conditions and illnesses?
So as the COVID pandemic began, we felt the need to help the fight against COVID by taking the treatments to people's homes. However, these treatments are not just confined to COVID. Hypertension, diabetes, all chronic illnesses can be treated from the comfort of the house,
okay,
including any other treatments that do not require theater or extensive medical procedures can be treated at the comfort of the house. And
yes,
for instance, if someone is diabetic and they need to have a checkup with their doctor on a monthly basis, there's no reason why they should go to the hospital and expose themselves in a way because of the high COVID cases in some places.
yes.
We could send a physician to their house to do whatever checkups are needed and then get the results and review their medications.
All right, now I'd like for you to just help us understand, the pros and cons that home-based care does offer when it comes to specific things. During this COVID, so much came out, and mental health was one thing that was of such big concern for so many people. And consequently, you find that so many people would need counseling. Is this something that is also considered when you are venturing into home-based care?
Yes, Jain. Actually, with home-based care, it is not just for the doctor or for the nurse. It's for all health workers who we have partnered with, and we go all the way to people's homes. Like, for instance, we are able to do an ultrasound in someone's house. We just need to send the sonographer with the portable ultrasound machine to the house. We are able to do counseling. We are able to do laboratory tests. We are able to deliver medicines. We are able to do a lot. Obviously, there are certain things that cannot be done at home, like theater cannot be done at home. If someone needs surgery, they are supposed to be in hospital. An ICU is best done in a hospital setup. Yes. But certain things like oxygen, for instance, we have oxygen cylinders and oxygen concentrators, and we take the oxygen in a timely manner to the people who need the oxygen right at their houses.
All right.
So
now,
basically, all types of medical treatments that can be done at the comfort of the house are done. And again, this is done throughout the country. Someone in need of treatment at home can get in touch with us from any part of Kenya. We've figured out the logistics, and obviously some places are a bit interior. However, we look for the nearest health facilities that can assist us get the personnel that are needed to go to the homes of these people.
Okay, now when it comes to keeping up with those logistics, we are living in a time where we have so many quacks in the medical fraternity, and, they have also gone as far as, even getting documents to just justify their genuineness. When it comes to making sure that you're actually working with proper, legit professionals from across the country, as you say, how do you ensure that you are actually dealing with professionals and they're the ones that you're sending home to the different patients?
Yes, Jen, that's a very good question. We prevent our doctors, nurses, nutritionists, counselors, lab people, laboratories, pharmacies, and every aspect of medical treatment. We already have prevented them. We know how good they are, and we only work with people who are registered, who are competent, and who know what they are doing. If the nearest person is miles away, then we also partner with ambulance services that ensure that the services are taken to the patient in a timely manner. And in the event that this patient requires to be sent to Nairobi or Mombasa or one of those bigger cities, then we also partner with, besides just the ambulance services, we also partner with companies that can airlift, like, say, Amref, for instance, that have the capacity to airlift someone from all the way from a far-flung area to Nairobi, for instance.
Okay. Now, one would be wondering, how do you go about when it comes to the executional part of this thing? How does it work?
So this is how it works. A person who is in need of home services, home care treatments, calls us through our lines or gets in touch with us through our WhatsApp or gets in touch with any of our staff through whatever means of getting in touch with us. And then once they get in touch with us, and they could get in touch with us from Garissa, from Kakamega, from Voi, from whichever part of the country, even here in Nairobi. Once they get in touch with us, we assign a consultant to this person to handle it with as soon as possible. And this consultant is mostly a medical person who calls back the person, gets the details very quickly so as to know what needs to be done. And after the teleconsult and understanding the medical issue, then we are able to send somebody on the ground. And that person can range from the doctor to a counselor to a lab person. However, we prefer that if it's a medical issue, it's a medic who goes there first. And after the medic has gone there, then it becomes easy for the medical person to decide that this is what is needed in this patient's situation. And then the rest of the services come in, and we try to ensure that all services are done in a very timely manner. Like, for instance, oxygen, you cannot dilly-dally with oxygen.
Yeah.
So yes, Jain, you can't dilly-dally with oxygen. Sorry.
Keep going. I was just agreeing with you when it comes to
you can't
the importance of getting oxygen.
So if someone needs oxygen and they are somewhere in Voi, then we have to look for the nearest facility that has oxygen and take it to the house. If they're in Nairobi, we have oxygen concentrators on standby. We have oxygen concentrators in the bigger cities on standby and oxygen cylinders. We take them to their homes. And we ensure that whatever happens has to happen in a very timely manner, because this is about saving lives. And especially because of the COVID pandemic, time is of essence. Many of our patients have been COVID patients, and we have ensured that the services are brought to their doorstep, including oxygen, and then including the nurse, which is more like a 24-hour nursing care. We provide PPEs to our health professionals. They stay in their homes. So obviously, if somebody has to stay in the home, the COVID protocol again has to be observed very, very keenly, because these are people's homes. The patient has to be isolated if it's a COVID patient. Yes. We also ensure that our healthcare workers are well taken care of. They are protected. So we provide all the PPEs they need. We do our best to provide the best of the best. And in precise healthcare, we offer world-class services. We think globally, but act locally. We have a mindset of the worldview when it comes to healthcare. However, since we are based in Nairobi, based in Kenya, based in Kisumu, based in Mombasa, based in Garissa, based in Moyale, and all the cities that we have capacity to go to for healthcare, home-based care, we ensure that we not only see the local scene, but also think globally. Okay. What are we able to do that can be done in the US, that can be done in Spain, that can be done in China, that can be done in Australia, that can be done in South Africa? That's how we think. We do not just think about our situation. we think...
Yeah, and that actually brings me to the next aspect, in terms of advancing and keeping up with the global trends, and especially in the medical space. And we just want to understand, what are some of those advantages that do come along with home-based care? And this goes out especially to those who are watching us this morning. There's a Kong who's saying that virtual hospital programs have the potential to provide health systems with additional inpatient capacity, and especially during this pandemic. And we just want to look at some of those advantages that come along with home-based care. And let's just start by understanding the finances that are involved in this, comparing it to, mainstream ways of getting medical services. What is the difference about the finances? Is it cheaper to get home-based care as compared to the traditional way of going to hospitals?
Yes, Jen, that's a very good question. It is actually not only convenient to the patient because they're being treated at the comfort of their home. That's their natural environment. That's what they are used to. So there is no feeling that I'm in a strange place. Mm-hmm. The food that is there is what they are used to. If they like taking duma for breakfast, it's gonna be provided. It's not so easy to get what you want every time in a hospital setup. Sometimes, of course, in some private hospitals, you have to tick what you want, but it may not be exactly prepared the way you like it prepared at home.
Yeah.
And besides that, there is the comfort that your people are around you. If you're having COVID, you could be in isolation, but it's your house and your people are within the area or are within the house. You're in a separate room. If it's not COVID, like say you have stroke, for instance, then there's a psychological healing that your people are there with you. Besides all that, the cost is definitely lower than the cost in a hospital. Mm-hmm. Certain things that would be there in a hospital are removed from the picture. Like, for instance, the hospital bed is not part of the bill. Let's put it that way. So because of that, it's cheaper. I would use the word, it's more affordable or more cost effective than going to a hospital setup.
Okay.
Then, yes.
Now, another aspect that, is of much concern to many people who may be considering going this way when it comes to home-based care versus the traditional way of accessing medical services is issues to do with management. We have had so many people who have been mismanaged, misdiagnosed when they are seeking medical services. Looking at home-based care, would you say that there is a better management as opposed to the traditional way of seeking medical treatment?
In my opinion, and based on the experience I've already had, Jain, I would wish to just say that it has been excellent in terms of the outcomes of management. We've had very good outcomes with management of COVID-positive patients who've recovered well on home-based care, and many of them have been on oxygen. And then besides that, we've seen that the psychological aspect of the treatment is taken care of because of the personalized touch with the nurse who is there with you at home, who knows what you've had for breakfast, who understands how you slept last night. So when the nurse is giving information to the doctor via teleconsult, which happens a lot, or when the doctor comes physically to do the ward round in the house, then the nurse is able to give the doctor all the relevant information. The nurse is able to say, oh, this person slept well until 2 a.m. when they started sweating, or when they felt their temperature was, it's more personalized because the nurse is there throughout and the nurse is with you. There are no shifts per se, the way it happens in hospitals. Of course, you may have nurses changing, but mostly we have, if it's a 24-hour, we have the nurse stay with the patient.
Okay.
For quite a duration. So it's very personalized. The healing process is better, and it's even faster.
Okay.
Many of our COVID patients have had their treatments and done very well within a short, I would say a good duration of time.
All right. Now, as we draw the conversation to a close, are there those challenges that you also do encounter when you are trying to deliver quality home-based care?
Yes, Jain. There are challenges always exist with some new things like this one. And one of the challenges is just logistics, ensuring that oxygen is delivered when it's needed, ensuring that medicines are delivered to a remote part of the country when it's needed. So obviously we partner with people who are in logistics who help us to do that. The other challenge is if we take a bit of time to get the right medical specialty, but we have pre-vetted many of them and they are on call. So if we don't get this one, we have an option B of getting another one who will be able to assist us. So besides all the challenges, we are up to the task and we are taking it with a lot of seriousness because this is gonna help a lot of Kenyans who wanna be treated at the comfort of their homes and who have relatives who are in the village. Bringing them to Nairobi sometimes is a bit of a challenge. We will take our doctors, our nurses, our counselors, our nutritionists, our lab people right to the house, and we will offer the same quality treatment. In fact, if some lab tests need to be taken to Nairobi, Mombasa, or Kisumu, or the bigger cities, we will ensure that that happens, and we will still receive the quality services that you need. But also, if the patient is sick enough to require to be put in an ICU or HDU, or to require theater, or to just require hospitalization, then we take an ambulance and send the patient to the hospital.
All right. Well, due to the constraint of time, we'll have to put a cap on this discussion at that particular point. But thank you so much for being with us this morning and for sharing with us that information when it comes to home-based care. We have been speaking with Dr. Theophilus Wangata, who is a general physician at Precise Healthcare. Thank you very much, Dr.
Thank you so much. Please remember to call us on 0713 749 001. And God bless you all, and stay healthy and stay safe.
So thank you so much, Dr. We will definitely take your advice.
Yeah. Thank you.
All right. On Twitter, we have Mikai Kiloki, who's saying home-based care is one of the best approaches ever when it comes to the fight against COVID-19. And as players in this fight, we should repackage this information well and target the key industry players within our community in order for home-based care to succeed. There's also a tweet here by Eve who says, although home-based care has been hailed as a more effective method of handling patients, those who have tried it say it does not come cheap. So then again, it all boils down to personal preference, but this is where the globe is slowly but surely gravitating to, especially when you need personalized healthcare services. So we will be sure to have more of this discussion, so just make sure that you have all the information at your disposal before you get to decide which path to take when it comes to medical care on a very personal level.